find a place to have some coffee. It got a bit windy, but I think in there we may be sheltered from the wind. Let's find a seat.
What's up, guys? Welcome to Red Bean.
This week is a little bit of a strange week for everyone, I guess. We're in the middle of the coronavirus outbreak or pandemic, and everything has changed for everyone. Things are not really the way we are used to, and they probably won't be for quite a while.
The Norwegian government has put in place restrictions of social contact. Schools are closed. A lot of jobs are closed. Most people are being told to work from home. And a lot of cafes, restaurants are closed.
This is a difficult time for the whole service industry and hotel industry and, well, many industries.
We also expect to see this at the hospital, of course.
Yeah, you're a nurse, so you're gonna be in the thick of this.
Yeah.
Today is Wednesday, March 18th, and the status this morning when we opened the newspaper was almost 1,500 infected and 4 dead. And this is just the beginning. We've seen what happened in Italy with 2,000 dead now, isn't it?
2,500 yesterday.
2,500 dead in Italy.
500 are dying every day.
Yeah.
If it continues in this rate. So nobody knows what's happening. And we don't either.
The Norwegian government has put in place pretty severe restrictions. They recommend everyone staying and working from home as much as possible. All the schools are closed. All public venues are closed. All bars and restaurants and everything is closed. The city is like a ghost town almost. Today we took a ride through the city and you can see almost no people in the streets. It's in the middle of the day on a Wednesday. Normally the streets would be packed, but not this week.
Not this week. But we're not alone in this. It's the same all around Europe, and Asia has been this way for a while. America might be coming after. We'll see.
Yeah.
So we're all in the same boat here.
Everyone faces a very uncertain future right now. Everyone. And like the government keeps telling us, this is the time for solidarity and sticking together, but not physically.
And let me point out that we live together, so we share the same microflora anyway. That's why we're sitting so close together now. I've been out of work for a couple of days now because I have an airway infection. I'm coughing and I've had a fever. That's passed now. I do feel a lot better now, but I still cough. And the hospital has said that no staff members with symptoms of airway infections should be at work, which I get. Now, I was tested on Saturday.
The whole country is on lockdown and in quarantine almost. And Pia, since she's a nurse, she is required to get tested.
Because I have an airway infection.
Yeah. So that's what we're about to do now. We're heading to the hospital to get tested.
She put a swab down my throat and I was like, I gotta cough. I didn't want to cough on her. So I was like... So at that point, it wasn't corona. The situation at the hospital is so severe because a lot of people are not at work. And so it's very imperative that I stay healthy and don't get infected because I work with patients who are quite weak and obviously need me to be healthy. I don't want to give my patients or my coworkers anything. The government has also forbidden all health personnel to leave the country. So since I am a nurse, I am staying. So that means we're not really thinking about our trip too much these days, or I guess we're thinking about it, but we're trying not to lose hope in it happening at all.
Yeah, right now it looks a bit bleak. Everything has changed. The whole world has changed. Right now, Africa is starting to report cases, and they're about a month or more behind Europe now. And the healthcare system in African countries are not the same as in most European countries.
Absolutely not. They're not prepared for this at all.
European countries are not prepared, so African countries with limited resources will struggle.
They will.
So right now it really looks like our trip will not happen, at least at the time that we were hoping for.
Mm-hmm.
We still cross our fingers and hope that this will pass quicker than people expect, but
At the same time, we're being realistic about it.
yeah,
This is our number one priority now, is to get through this crisis, and we need to stay and fight.
especially you as a nurse.
Yeah.
Healthcare people are in demand right now, and it would be irresponsible to leave the country in a crisis.
I don't want my coworkers to be dealing with all that stuff alone. And although it might feel like my contribution will be small, then at least it's something.
We still want to keep hope alive, and we're going to keep planning for our trip. But we keep in the back of our minds that things may change. And so Africa may not be possible for us at this time. So maybe we will change our plans a little bit. It's just something we're thinking about. We haven't really decided anything.
No.
But we're sort of considering alternative routes. Maybe going east instead to start with. That would maybe give us a few more months, or give Africa a few more months to recover, so that the borders could open and we could go to Africa. We don't really know.
We don't.
Right now everyone is confused and nobody knows anything.
But we do know that it's time to go to war.
How are you guys dealing with this crisis? What's happening where you guys are?
We'd love to know.
I think, like, for our sake, we're young and relatively healthy, so I don't think this will be that much of an issue for us personally. But I'm really afraid for my mom, for example, who has some underlying conditions. What are you guys' thoughts on this? Do you think the governments are overreacting, or do you think it's the right thing to do, closing down the whole world? What do you think the consequences of this will be?
And how is it affecting your family while we're in this crisis? Because it is a crisis.
It is.
I think it's important to have some perspective. Our grandparents were called to war, and we are called to stay inside. We can do this.
When you look at the history of plagues for the past 2,000 years or so, like the worst pandemic we've had is the bubonic plague, which killed about 200 million people. If you think back a few years to the SARS epidemic, SARS virus, that only killed 770 some people. This thing has so far killed how many people? 6,000? So it's almost, it's closing in on 10 times the damage that SARS caused. And we're just in the beginning. For the next week or so, things will gradually get worse and worse. And in 2 or 3 weeks, probably the full epidemic will kick in. Everyone is talking about flattening the curve, and it's kind of weird and a little bit disturbing, but understandable to hear politicians talk about expected deaths. They're putting in measures not to keep people from dying, because people will die anyway, but to make sure that so many people don't get sick at once that the healthcare system gets overrun. Those are difficult decisions.
It's a difficult reality we're facing.
And for you healthcare professionals and doctors who have to make these tough choices, like you're hearing from Italy now, where doctors have to choose who gets to live and die. That's always a part of a doctor's job, but now they have to do that every day, make those choices every day. So this is a difficult situation, and we don't really know how to deal with it, or how to handle it, or what to do, or anything.
Like anyone else.
Yeah, we're a bit lost.
Yeah.
But the most important thing to know is that this will pass. Like any other plague in history, it passed. Yeah, it's gonna leave death and destruction around it, but the earth keeps spinning and the sun will keep shining. So what's important to remember is that there will be a tomorrow. There will be a time when all of this is over, and we can't stop everything. So we're gonna keep planning our trip as if this is not happening, but we're gonna take precautions and be flexible for change if we have to. But no matter what happens, we would like to thank you guys for watching our videos so far. And we're gonna keep making videos for as long as it makes sense to do so. And we're gonna keep hoping and dreaming about traveling, because if you have nothing to dream about or hope for, then it gets very difficult to get through this situation. So we just gotta stay positive and take life as it comes. There's not much else we can do.
The giant carrot in the other end.
So thank you guys so much for watching, and if you like this video, don't forget to hit the like button, subscribe, and click the bell so you don't miss our next video.
If you want to support us, head over to ridebean.com, where you can get your own bag of coffee or one of our t-shirts.
Thank you for watching.
See you next time.